Uh, just to update first on our Center City Vaccination Center here at the Convention Center. That center now is using Pfizer vaccine and delivering first doses of the vaccine. They vaccinated 4,000 people yesterday and 4,000 people Wednesday and about 4,600 people yesterday. Now, this site was originally scheduled to continue for only about 1.5 more weeks, but we requested and the federal government granted a request for a 4-week extension of the federal staff. That will take the site to 6 weeks from this past Tuesday, which will then give us enough time for 3 weeks of first doses and 3 weeks of the second doses. In addition, the federal government granted us 4,000 doses per day of Pfizer vaccine in order to supply that clinic. Now, that clinic can administer up to 6,000 doses per day. So the difference, the additional doses beyond that 4,000 will be provided by the health department from its Philadelphia allocation. Now, the federally supported type 2 vaccination site at Esperanza at Hunting Park continues. It yesterday changed to the Pfizer vaccine. It was originally planned to be using the Johnson & Johnson vaccine. And during that transition, there were 220 people vaccinated yesterday. It is now going to be open 5 days per week, Monday through Wednesday, and then Saturday and Sunday in order to accommodate people who work Monday through Friday. The hours will also change day to day also to accommodate people who work a 9-to-5 type schedule. It'll be open Monday and Tuesday from 7 a.m. to 3 p.m., Wednesday from noon to 8 p.m., and Saturday and Sunday from 9 a.m. to 5 p.m. This site will also do 3 weeks of first doses of Pfizer vaccine, followed by 3 weeks of second doses of Pfizer vaccine. And we will be stepping up our outreach into the surrounding neighborhoods to connect people to this clinic, both by scheduling appointments and encouraging them to walk in. And walk-ins are very much accepted and encouraged at that site. Now, just a couple words on the Johnson & Johnson vaccine. As you know, that's on pause right now. We are awaiting guidance from the FDA and the CDC about that pause. We hope to get information from them at the end of next week, and we hope that there will be some ability to start using that vaccine. Just a reminder that the blood clots that have been seen that may be associated with this vaccine have been extraordinarily rare, roughly 1 per million doses delivered. That risk, even if it is connected with the vaccine, is more than 1,000 times lower than the risk of serious infection from COVID-19. And just a couple words about vaccine eligibility. As you know, we planned to expand our eligibility into phase 2 on this coming Monday, April 19th. But this week we heard from an increasing number of hospitals and pharmacies and our own mass vaccination sites that they're having difficulty filling the vaccination slots. We don't want those vaccination slots to go unused. So we are expanding eligibility for vaccination to all adults immediately. When I say all adults, I mean everyone over the age of 16 for Pfizer vaccine, or everyone over the age of 18 for Moderna vaccine. Now, while everyone is eligible, we are still concerned about vaccination rates in our people over 65 who are most vulnerable. So we're still encouraging our sites to give priority to people over the age of 65. And at the clinics that the city is managing, we will be inviting people over the age of 65 first, but again, everybody will be eligible. So just to remind people, what should people do who want to be vaccinated at any age? Go to our website, www.phila.gov/vaccine-interest, put your name in our database. If you don't have an internet, call 311, and they'll get your name in our database, and you'll be called with an opportunity to schedule an appointment. In addition to that, pharmacies, hospitals, and clinics have their own online signups, and we're encouraging more and more providers to allow walk-up access. That's enough for now. I'll be happy to answer questions later. Now I'll turn it over to Mcchrystal Yates.
Thank you, Dr. Farley. So good afternoon, Dr. Farley and the members of the media that are joining today. I appreciate you having me today to explain what the Philadelphia Fire Department has been doing as far as the vaccine efforts go. So the fire department has been partnering with the health department on vaccine distribution since the end of December. Paramedics and now advanced EMTs are healthcare providers who, in the state of Pennsylvania and others, are able to provide vaccinations as part of their scope of practice. Our efforts have included the vaccination of our own workforce of essential healthcare workers. We started our employee vaccines in late December, and we completed our final employee clinic in early April. Our COVID task force, which includes 2 paramedic captains, both of whom are licensed nurses, run the program with a paramedic lieutenant and 2 paramedics. This team leads the medical aspects of our vaccine clinics. We have firefighters, EMTs, lieutenants, and captains providing a great deal of logistical support to our clinic and other clinics across the city. In late March, the fire department began hosting fixed site location clinics in West Oak Lane, West Philadelphia, and Northeast Philadelphia. Pop-up clinics have been mainly associated with faith-based communities throughout the city. And then lastly, we're piloting a mobile vaccine clinic to provide vaccinations to homebound people around the entire city. We at the fire department are committed to the residents of Philadelphia, and we are happy to participate in the overall effort to vaccinate the members of our community. To date, we have administered nearly 7,000 vaccines. Our clinics, of course, are paused while we wait for further direction on the Johnson & Johnson vaccine, but we're looking forward to continuing our clinics as soon as we can. Just some data about our community clinics. We have 3 fixed sites. We have done 10 clinics since March. We have administered 4,775 vaccines in those clinics. We have had 3 pop-up clinics where we administered 500 or 600 vaccines. And then we have vaccinated 54 homebound individuals in the city. And we started that pilot last week. So that's all I have, Dr. Farley. I'll turn it back to you because I know that there's limited time and we have to get off at 1:30.
Thank you very much, Chief Yates. Now turn it over to Ms. Zelly Colon, who will present Dr. Farley's remarks in Spanish. Zelly, go ahead.
Buenas tardes, mi nombre es Eli Colón, aquí con ustedes para compartir el mensaje del Dr. Farley para el viernes 16 de abril. El centro de vacunación de la ciudad en el centro de convenciones empezó a usar la vacuna de Pfizer esta pasado martes. Vacunaron a 4,000 personas el miércoles y a 4,600 personas el jueves. Originalmente, este centro estaba programado para continuar 1 semana y media más, pero el gobierno federal otorgó por 4 semanas de extensión del personal federal. El centro operará 6 semanas desde el pasado martes, tiempo para 3 semanas de primera dosis y 3 semanas para la segunda dosis, ofreciendo más de 4,000 dosis de Pfizer al día. Dosis adicionales serán proporcionadas de la asignación de Filadelfia. El sitio de vacunación tipo 2 apoyado por el gobierno federal en Esperanza en el vecindario de Hunting Park empezó a usar la vacuna de Pfizer ayer, administrando 220 dosis. El horario de atención es el siguiente: los lunes y martes desde las 7 de la mañana hasta las 3 de la tarde, los miércoles de mediodía hasta las 8 de la noche. Este centro estará cerrado los jueves y viernes a partir de la próxima semana y los sábados y domingos estarán abiertos desde las 9 de la mañana hasta las 5 de la tarde, ofreciendo 3 semanas de primera dosis y 3 semanas de segunda dosis. También hemos intensificado la divulgación en los alrededores del vecindario. Sobre la vacuna de Johnson & Johnson, las clínicas del vecindario administradas por el Departamento de Bomberos de Filadelfia están actualmente en pausa, mientras esperamos nuevas directrices de la FDA y CDC. Esperamos recibir orientación a finales de la próxima semana. Un recordatorio: los coágulos sanguíneos son extraordinariamente raros, 1 por cada 1,000,000 de dosis. El riesgo es 1000 veces menor que el riesgo de infección grave por el COVID-19. ¿Quiénes son elegibles hoy? Habíamos previsto ampliar la elegibilidad de la fase 2 el lunes 19 de abril, pero se escuchó del creciente número de hospitales, farmacias y clínicas y sitios de vacunación masivas que están teniendo dificultades llenando sus citas. No queremos que las franjas horarias de vacunación no sean usadas, por lo tanto, estamos ampliando la elegibilidad en todos los sitios inmediatamente. Todos los mayores de 16 años pueden recibir la vacuna de Pfizer, los mayores de 18 años pueden recibir Moderna, Todavía estamos alentando dar prioridad a las personas mayores de 65 años. Las personas que quieran vacunarse deben registrar su interés en el www.phila.gov/vaccine interest. Si no tiene acceso al internet, llama al 311 y ellos los escribirán. Además, las farmacias, hospitales y clínicas ofrecen sus propias líneas de registro. Estamos alentando a los proveedores a permitir el acceso abierto sin cita previa. Muchas gracias.
Thank you very much, Zelly. We'll now move to Q&A. Reporters are asked to limit their questions to 2 or fewer today. Please try to keep your questions focused on the topic at hand, which this week includes the work that the Philadelphia Fire Department has been doing with COVID vaccinations. If there are any reporters who do not get the opportunity to ask questions, please follow up with us by email and we will get you an answer. First up, we're going to turn to Jeff Cole from Fox 29. Jeff, you can go ahead and unmute.
Hey, folks. Dr. Farley, first question. At the convention center today, it looked to us like you were, in fact, allowing walk-ups today. Was that the case? Are you allowing folks to walk up at the convention center today? And also, are you folks imposing the Philadelphia residency restriction? We didn't hear that. Looked to us like if you wanted a vaccine, you could walk in and go get one today.
We are allowing walk-ups today. That site is a combination of appointments and walk-ins, trying to make it as easy as possible. For some people, an appointment makes it easier. For other people, being able to walk in makes it easier, so we're doing both. They should be just Philadelphia residents. I don't know how that's being screened there, but we are really just trying to have it be Philadelphia residents right now.
But it's not a problem if they're from outside the region and they happen to get a shot there, right? If the goal is to vaccinate everybody and as many people as we can, right?
Well, overall, about 25% of the vaccines that we've been administering are going to non-Philadelphia residents, but the vaccine that it's allocated to us is based upon the Philadelphia resident population. So it's sort of shortchanging the residents of Philadelphia if we vaccinate too many people outside the city. And so we haven't been as hard-nosed as maybe we could be, but we're trying to really make sure that the people in Philadelphia have an equal opportunity to be vaccinated as those who live outside the city.
And one more, the fact that you, are you concerned that the fact that the slots are going unfilled, so obviously you've gone to phase 2, is that a sign of hesitancy about the vaccine? And is that your next big obstacle, hesitancy?
It is a sign that the people who are most eager to get the vaccine have probably already been vaccinated, and that our supply is now about equal to our demand or maybe surpassing that. And so we are entering a new phase where we're going to be more in the position of really encouraging people to come and make it as easy as possible rather than restricting access to only some people because we have too many people, more than we can accommodate.
Thank you. I appreciate it.
Thank you very much, Jeff. Next up, we're going to Isabel Sanchez from Telemundo 62. Isabel, you can unmute.
Thank you so much. Dr. Farley, yesterday Pfizer said that we will most likely be having a third dose coming up to us next year. How is Philadelphia preparing for that scenario? And you think this might become into like a yearly thing, just like the flu shot?
Now, we certainly don't know whether that's going to happen, whether we'll need a booster or an annual booster. It's definitely a possibility. I would say right now we're still focused on getting this first set of vaccines out to everyone. But as we build our infrastructure to do that, we're building that with the idea in mind that we may need to have that infrastructure over the long term. So, you know, the sort of the neighborhood clinics and the mass clinics and our work with a variety of other vaccination providers. At every step, we're just thinking, how do we build this in a way that it may be more of a permanent setup?
Isabel, any other questions?
Yes, one quick thing. You mentioned outreach for the people who live in the neighborhood near the Esperanza Clinic. Could you expand a little bit more on that? What are you guys doing to make sure that folks who live nearby actually get the vaccine?
So there's the relationship with Esperanza, the organization, and they have their own ties to the community and are out communicating with people in the community through their members and their relationships. Then we have health plans who are calling their members on the phone and encouraging them to go to all sites, including that site. We also have staff that are at some high volume sites in person, people like food distribution sites. And if someone comes up, they can schedule them for an appointment and also help them with transportation. And we're also doing our own, what we call phone banking, where we have staff calling people in the area, letting them know about the clinic availability. Right now, they're just providing information about it, but soon they'll be scheduling people who want to have their appointment scheduled on that phone call. And over time, I think you're going to see more and more of that, both phone outreach and in-person outreach.
That is wonderful. Thank you so much.
Thank you very much, Isabel. Next, we're going to move to Maggie Kent with 6ABC. Maggie should be able to unmute.
Hi, thank you for taking my question, Dr. Farley. Mine is also along the lines of seeing how these appointments or these clinics are having unused or non-attended appointments here at the FEMA clinics, and you're expanding the eligibility. What is it telling you about supply, and is there a concern about vaccine being wasted? Because as we know, vaccines last for a certain amount of time.
Well, vaccines can last a long period of time in the freezer, and we only bring them out to according to the number of people we estimate to vaccinate each day. We're pretty careful about that. There's always a certain amount of wastage. You can never be 100%, but that's really been pretty small. It does mean, though, that we are entering a new phase now, to where the people who are left unvaccinated are maybe not as eager as the people who've already been vaccinated, and that we will have to work harder to persuade people to be vaccinated and make it easy for them to be vaccinated, because we all have an interest in as many people being vaccinated as possible, because that protects everybody.
Thank you. My follow-up question is about the encouragement to get people vaccinated who maybe have been on the fence for quite a while. I know you mentioned that there are phone banks and people calling. Is there going to be any other kind of advertisements or PSAs, things like that, to really encourage those holdouts? And secondly, where are we in terms of vaccinations? I know that we have to reach that 70 or 80% to get that herd immunity. So what percentage are we at right now? How much more convincing do we have to do?
We still have a long way to go. You can look on our website and we have the numbers, but we're roughly 40% of the people having at least one dose. Yes, we are going to be using the tools of the mass media to encourage people to be vaccinated. It started already, where we're having ads in ethnic newspapers and publications, and through social media and on the web. That's going to grow over time, and it'll be going on for months, using a variety of different messages to encourage people about the safety of this and the importance of vaccination. So that's going to be taking place at the same time that we are having this community level outreach, and at the same time we're trying to make it easier and easier for people to get in who are interested.
Thank you.
Thank you so much, Maggie. Next, we're going to go to Laura Mcchrystal from the Inquirer. Laura, you should be able to unmute.
Hi, Dr. Farley, I'm wondering, with this sort of slowdown in the number of people taking appointments, are we moving into this new phase, as you call it, earlier than you had anticipated?
You know, it's hard to say. Back when this first started in December, I kind of thought maybe it'd be around April that we would getting around phase 2. That was a wild guess, and it is about right in April. It is still, though, there's a lot of people who are unvaccinated. And so we've been through this period when it's been hard for people to be vaccinated. Now it's getting easier. And so it's really an entirely new task for us now, and that's all of us, to encourage everybody to be vaccinated. And it's going to be a different amount of work, a different type of work, and a different amount of work to get the vaccination coverage that we all want.
Okay, and does it worry you at all, sort of the timeline to potentially reaching herd immunity? Are we going to experience a slowdown as you're really trying to encourage those people to go get their shot?
Well, we'll find out. There are surveys that suggest that there's, maybe 10% or so people who out and out say they will not be vaccinated. But then there's a fairly large group of people who are, they're not eager to be vaccinated, but they're not totally against it either. You might call them wait and see people. And that's who we need to be reaching now. Make it very easy for the people who aren't quite sure. But, if they see that other people are doing well, if they get more confident, it's easy, then they'll be vaccinated. There's a lot of folks like that can be vaccinated. If we reach all of those, that could still be a pretty high percentage.
Okay, and one last quick question with the Esperanza site. I think you said it was about 200 vaccinated yesterday. If I recall, you had been aiming to get, at least 1,000 a day at that site, ramping up to even 2,500. Are you concerned about, that the outreach up there isn't going as well as you had hoped with that small number?
Yeah, so remember at that site, we were planning to use Johnson & Johnson vaccine. And so we'd scheduled that, and then we had to cancel all of those appointments for Johnson & Johnson and then restart with Pfizer. So this was really the first day we're getting restarted. So we didn't have the full time to get people scheduled for that. And so I'm hopeful that that's the reason that number was so low. Nonetheless, we are concerned. We want to have all of our vaccination appointments used. And so we are amping up our outreach, and we're going to have to just watch our numbers and see how many people do come in.
Okay, thanks.
Thank you very much, Laura. Finally, we're going to move to Lauren Make from Channel 10. Lauren, go ahead.
Hi, Dr. Farley. Regarding the open slots that you're seeing, we always knew we would hit that point where the enthusiastic folks had already been vaccinated, but were you surprised that there were slots that weren't being filled?
I say, it came a little earlier now than I might have predicted, say, 3 weeks ago. I don't know how many eager, 20 and 30-year-olds we're getting. It may be that now that we've opened it up to those people that we're going to get a big surge and we won't be having open slots for a while. We'll find out. But we definitely, it's clear to us now that our task is different. Our task is encouraging people who may be unsure to come in and get vaccinated. Up until now, our task has been to try to sort through all the people who want to be vaccinated and have the highest priority people vaccinated first. So that task is shifting really nationally right now, but in Philly as well.
And as you try to get more people vaccinated, can you give us a sense of how you're feeling about the cases that you're seeing here and the types of cases that you're seeing here? Of course, we've heard about concerns about Michigan and other places. What's your level of concern about what you're seeing here in cases?
I'm very worried about the high case counts right now. We're averaging over 600 cases per day, and we have over 500 people in the hospital. The number of deaths we're seeing per week hit a low in the 20s, but now it's getting closer to 40, and I expect that's going to be up to 50 per week. And so I'm worried that people believe that the problem is behind us, and it's not behind us.
Thank you.
Thank you very much, Lauren. We have one more question here from Hong in Chinese US. You should be able to unmute now.
Is it confirmed that?
Oh, hi, Dr. Farley. I have one question. Any data or information about variants of COVID-19?
I'm sorry, can you repeat the question? I didn't understand it.
Any data and info about the variants of COVID-19?
Oh, information about the variants? Well,
yeah.
You know that the number of variants that are being recognized in Philadelphia continues to steadily increase. The most common variant is the one that's called B.1.1.7 that was first recognized in the United Kingdom. I can't express it as far as a percentage of all those tested because I don't have that information, but I can tell you that the number that is being recognized each week is increasing, and it's a pretty substantial fraction of all the cases that are seen in the city.
Thank you.
Thank you very much. Any other questions? All right, looks like not. Last call for questions from folks. All right, not seeing anybody raising their hands. I just want to thank everybody for joining us today and thank Chief Yates for joining us as well, giving the update. We hope to see you all again on Tuesday with the city's regular briefing. Thank you very much and have a safe weekend.